Greetings and welcome to the Medicare 101 educational webinar. I'm Sherry Gordon Harris. I'm the CEO of Royal Purpose Shield, independent agency, protection for your family, finances, and future. Thank you for joining us today. Today will be an overview at a high level about Medicare. Are you new to Medicare? Would you like to understand your Medicare options? Would you like extra help paying for your prescription drugs? Well, this webinar is intended to share that type of information with you. So let's get started. So again, this is Medicare 101 presented by myself, Sherry Gordon Harris, with Royal Purpose Shield, protection for your family, finances, and future. And just a couple of housekeeping things. This is a CMS compliant educational event. No specific plan details will be discussed. And also, to further disclaim, my agency does not offer every plan available in your area. Currently, I'm representing a limited number of organizations which offer products in your area. To find out all products that are available to you, please contact Medicare.gov or call 1-800-MEDICARE to get information about all of your options. Again, today's agenda is to give a high-level overview to educate you on Medicare in general. Understanding its parts, what to do when you're new to Medicare, also if you need extra help paying for prescription drugs. That type of information will be shared in this webinar today. Then we will have a Q&A session at the end, Ask the Medicare Maven, and then explore next steps. So again, this is Royal Purpose Shield, and this is my information. I am a licensed life and health insurance broker. Broker meaning I do business with more than one company. But I also am an agent because if it gets to you deciding that you want me to help you on a one-on-one basis, I can become your agent and work for you. I am licensed in multiple states, and my number is 309-585-6145. Or you can send me an email at info@royalpurposeshield.com. And that is a list of services I provide. But today's focus is on Medicare education. So what is Medicare? Medicare is a federal health insurance program, normally for those that are age 65 who have paid Medicare taxes for 40 quarters or more. So that's if they or their spouse has paid Medicare taxes, usually deducted from payroll when working for 40 quarters or an equivalent of 10 years or more. Some people receive Medicare when they're younger than age 65, after they've received at least 24 months of disability insurance benefits. So I do want to make the difference and point out that is Social Security Disability Income, SSDI, which is different from SSI. SSI alone would not necessarily qualify you or qualify a person for Medicare. So there's a difference there. SSI different from SSDI. Also, people may not be age 65 or may not have paid into Medicare taxes for that amount of time, but have some illnesses such as end-stage renal disease that require dialysis or a transplant. Also, if they have like a terminal illness such as Lou Gehrig's disease, those types of terminal illnesses can get a person automatically eligible for Medicare. Now, Medicare is made up of multiple parts. There's two main parts to what's called original Medicare, or that red, white, and blue card, or traditional Medicare. But Medicare, the other parts that go with it, uses the first four letters of the alphabet. So there's four parts of Medicare, and we'll go through those one at a time. Medicare Part A. Medicare Part A covers inpatient hospital stays, skilled nursing, hospice, and some home health. Most people don't pay for Part A or pay a premium for Part A if they or their spouse have paid Medicare taxes for 40 quarters or more. And when they become eligible for that Part A, there's normally no cost for that. But one thing about Medicare, it doesn't cover everything or 100% of expenses. It covers about 80% of Medicare allowable and medically necessary expenses. So those things are key. They only pay about 80%. That means the Medicare beneficiary is responsible for 20% of the rest of that cost. So, and it has to be something that's allowed by Medicare. Medicare does not cover cosmetic services, things that would be considered just for beautification, such as, or nice to haves like dental implants, or things that are considered cosmetic. And so it also has to be medically necessary and allowed by Medicare. Next, Part B. Medicare Part B covers doctor's visits, preventative services, such as different screenings, outpatient care, durable medical equipment. Now, Part B is not free. There is a premium required for Part B. So that changes every year, and there's a base for that. Not everybody pays the same. The more money you make, you may pay more for Part B. But for this year, the base pay for 2026, the base premium for Medicare Part B is $202.90. So that's $202.90. If you are paying that, you are paying the base. For those that make a certain higher income, they may pay more. And to learn more about that, we can take a deeper dive into that, or I can help you understand what that might be for you based on your income. Next, Part D. So because Part A and Part B covers hospital and doctors, that is what original Medicare covers, and that is all that original Medicare covers, that red, white, and blue card. To get anything additional for Part A and Part B, one would have to seek those services through a private insurance company. And one of those parts that would be obtained through a private insurance company is Part D, as in drugs. So that's how we remember. Part D is for drugs or prescription drugs. So Part D covers the cost of prescription drugs that you get through a private insurance company. And when you get this type of plan, it normally has a premium, so you pay to be on that plan, and what's called formularies, which is basically a list of medications that that plan will cover and at a certain cost share split. So when I say it may be covered, doesn't mean that they will pay 100% of the cost and the Medicare beneficiary pays zero. So it may depend on what tier or what level that particular plan puts that particular covered prescription drug on. So that varies from plan to plan. Now, with Medicare Part D prescription drugs, there is a premium or a deductible for that. In addition to the premium for being on the plan, there is one for original Medicare, which is $615, which means a person that applied to would pay the full price of the prescription drugs until they reach $615 out of pocket, and then whatever the cost sharing agreement for that plan is, that would kick in at that time. Now, there's what's called a maximum out of pocket or a yearly out of pocket cost for prescription drugs due to some legislation that was passed a couple of years ago. So this year, the maximum that anyone on a Medicare prescription drug plan would have to pay out of pocket if they reach that amount is $2,100, so $2,100. Now, that is to help put a cap on the maximum amount of the cost of prescription drugs. Now, some people are on expensive drugs. They could hit that in just the filling of one prescription. But there's good news. One wouldn't have to necessarily pay that full $2,100 all at one time if they needed a payment plan. So there is a payment plan that they can get on an M3P payment plan that they can work out with the carrier to make installments on that. So there's that information, and there's more details on that, but just know that there can be and there is a installment payment plan for prescription drugs if it's needed. And I'll go back one. Not only is there help for getting an installment plan if you need help paying for some expensive drugs, there is help that you may be eligible for called extra help paying for prescription drugs, but it's not automatic for everybody. Some cases it may be automatically applied, but it's based on the income level, is income requirement and limits. It's also referred to as LIS, which those three letters in this context stand for low income subsidy. So that's something that myself as an agent help people become aware of and obtain and see if they're eligible for it and apply for that if they're needed, if it's needed, and we believe that they may be eligible for. So M3P, the installment plan, and extra help, also known as LIS, to help pay for Part D, Medicare Part D prescription drugs. Next, you have what's called Medicare Part C, or also called Medicare Advantage. So Medicare Advantage or Part C is one of the options that a person would have that is eligible for Medicare. That is a Medicare beneficiary that has both Part A and Part B. So to get Part D for the prescription drugs, a person only has to have Part A or Part B. Either or, they could have one and not the other. But to get a Medicare Advantage plan, it is a requirement that you have both. So what is an advantage to having a Medicare Advantage plan? First of all, you do still have to get a Medicare Advantage plan through a private company. It can include prescription drugs. It can also include extra benefits that Medicare, original Medicare, just Part A and Part B, the red, white, and blue card, does not cover or include, such as dental, vision, hearing. Some of these Medicare Advantage plans can include additional benefits as it's allowed for them to offer by Medicare. Some may offer gym memberships. Some may offer telehealth programs, 24-hour nurse lines, care coordination, health coaching, virtual visits, wellness rewards. The biggest thing is dental, vision, and hearing. So they put all of that and bundle that into one package, one place there. So that can be an advantage because then you only have to deal with one card, one company, whereas if a person only had original Medicare, they have the red, white, and blue card, and they have another card for the prescription drugs and potentially another card if they got additional supplemental help. So that's Medicare Advantage. Now, when can you enroll in Medicare and or prescription drug plans and or Medicare Advantage plans? There are certain times defined by the government or CMS, Centers for Medicare and Medicaid Services, have set forth and predefined. So there's several enrollment periods. The first one is called Initial Enrollment Period, or IEP. This is a 7-month period surrounding your 65th birthday. So it includes the month that a person turns 65, 3 months before they turn 65, and 3 months after they turn 65. So that's when they first become eligible for that. So when they first become eligible for that, they can sign up any one of those 7 months without penalty. And so I say penalty because if a person does not sign up for their Medicare or accept that when they're first eligible, they could potentially incur late enrollment penalty when they do accept it. Now, the penalty for Part B, if not signed up for when first eligible, is up to a 10% premium surcharge for each full 12-month period that the person could have signed up for but didn't. That's very important because that penalty never goes away unless there's some special program due to income limits that waives that for them. But in general, that penalty never goes away. So it's important to look at that when you're first eligible for Medicare to see if you're going to accept that Part A and Part B, or if you're going to defer it to accept that at a later date. And some people do that if they decide if they're going to continue to work or if they're getting healthcare insurance coverage through their or their spouse's job. And as long as that coverage is what's called credible coverage, as good as Medicare or better, then they won't incur a late enrollment penalty. But you'll want to check and make sure that it's credible insurance. So there is also what's called a Part D late enrollment penalty, potentially, that can be incurred. When a person first is eligible to enroll in a Medicare prescription drug plan, so they get A or B or they get both at the same time, it is important that they enroll in a Medicare prescription drug plan to avoid any potential Part D for drugs late enrollment penalty, because that penalty is 1% of the national base beneficiary premium for every month that they go without that prescription drug coverage. So I want to emphasize that it's important to get that Part D prescription drug coverage, not to incur that late enrollment penalty. And it's important to obtain that even if you think that you don't need it, even if you're not currently ill, even if you're not currently taking any medication, because once it may be needed and then you get it, it could have incurred and accumulated so many late enrollment penalties that it may be not affordable for you. So that is just something I want to emphasize and bring to your attention, and highly recommend and highly advise that you do whatever not to incur that late enrollment penalty. The next type of enrollment period is called annual enrollment period, or also called AEP. And that time frame is between October 15th through December 7th. Now, this is the time where people are able to enroll in a new Medicare plan or make changes to their current plan every year around that same time period. So that is looking at the current plan they have, assessing if it still meets their needs, make a change if they need to, or stay where they are if that's what's best for them and suitable for them, and they decide to do that. However, the coverage would not take effect until January 1st of that following year. The next enrollment period is called General Enrollment Period, or GEP, and that time frame runs between January 1st and March 31st. During this time, there are certain things that can be done. A person can also join a Medicare Advantage plan, or they can add Part B if they didn't have Part B. They have to fill out an application. If they say deferred Part B, but they want to get it now, they can apply and get Part B. They can apply for Part B and they would get it the month after the first of the month following that month that they apply for that. One of the things is, though, there's only one change that can be made during this period of time if something warrants for a change during that time. So it's important to know that. One thing that cannot be done during this time period is there cannot be a switch from original Medicare to a Medicare Advantage plan. They cannot join a separate Medicare drug plan if they already have original Medicare. And cannot switch from one Medicare drug plan to another if they have original Medicare only. The next enrollment period is called Special Enrollment Period. So this basically is any time of the year, especially any time outside of that regular annual enrollment period. Without having a special enrollment period, a person pretty much is committed to that plan that they signed up for or decided to stay with between that time frame of October 15th through December 7th. But there are certain qualifying events that could trigger a valid enrollment period to allow a person to change plans or make some changes. Some of those qualifying events include moving from one area to another where the plan may not be available in that area. Because to get on a Medicare Advantage plan, not only do you have to have both Part A and B, you have to live in the area where that plan is available. And that normally goes by county. That's why it's necessary to know the zip code and county that you live in. A person may have a change in employment status. They may decide to go ahead and retire or something like that. They may have a loss of other insurance coverage, which could be involuntary due to no fault of their own, or they may have a change in their marital status. And so they're able to either get on a spouse's plan or the reversal of that, get divorced and no longer on a spouse's insurance plan and now need to be on their own individual Medicare plan. So whenever that happens, it normally begins the month your current coverage ends and lasts for an additional 2 full months when you have a loss like that. So that special enrollment period. Next, we're going to talk about Medigap, also known as Medicare Supplement Insurance. This is another option that Medicare beneficiaries can have to help cover that 20%, that percentage or unknown amount that they would be responsible for. So Medicare Advantage is one option, a Medigap or Medicare Supplement is another option. Medicare Supplement, so it helps pay the out-of-pocket cost that's not covered by original Medicare, or that 20%. One thing that's different about supplements is they are designed as standardized policies, meaning they too use letters of the alphabet from letter A through N. But each of the categories and how they're set up is the same regardless of what company you're with, that you're looking at. But they too are offered by private insurance companies. It does not cover any additional services that original Medicare doesn't cover. So whatever Medicare covers, it will cover as well, but usually nothing extra outside of that. And normally these supplements do not include prescription drug coverage. Part D Medicare prescription drug coverages plans need to be acquired separately. And so there are different other costs that are covered by different letters of those Medicare supplements, in addition to that 20%. So, but this educational webinar is intended to give a high level of that. To know more about that, I'd be happy to have an appointment with you outside of this. Next, as we're nearing the end of this webinar, just want to review how Medicare works together. So when a person becomes eligible for Medicare, whether they or their spouse paid into Medicare for 40 quarters or more, they can obtain the red, white, and blue card. Normally, when a person is on Social Security, they receive that automatically. If some people retire or it's before they start receiving Social Security and become eligible, then it may be necessary to contact the Social Security Administration office and apply for that or request that card to be sent. But A, B, and C, and D can all fit together. But everyone's situation is different. So everyone needs to get advice and seek out what is best for them at the time they become eligible for Medicare as to which option they choose. And then here are some other pieces of information that's important to consider when dealing with these Medicare plans. First of all, normally these plans are individual plans, so it's not like a family plan or you put your spouse on. It's just for that person that is eligible for Medicare based on their credentials. But there's also, and that's considered individual Medicare. There's also what's called group Medicare Advantage plans. So group, kind of like employer group plans, comprehensive group plans when a person was on a job. However, group plans are specialized employer or union sponsored plans for retirees that bundle Parts A, Medicare Parts A, B, and D, but typically have lower premiums than what individual Medicare plans are offering. And normally, and most often than not, they have richer benefits like they may offer more dental, vision, hearing, whatever was negotiated and agreed upon between that private insurance company and that employer or that union. A lot of times these plans are of the type PPO, a preferred provider organization, which allows visits to providers outside of a network, or they could be a network type of plan, also known as HMOs or health maintenance organizations, chosen by the employer for this. However, I do want to emphasize that if a person is on a group Medicare Advantage plan, normally if a person leaves that plan, they usually cannot go back to that plan. So to sign up for an individual plan, leaving a group plan would need to be considered very carefully due to it may not be permissible for that person to get back on that group plan that's offered by that employer or that union. So it's highly recommended to review all the specific plan documents and the benefits and compare and understand what is being offered, the deductibles, the co-pays, the co-insurances, any perks that come with it that may be offered in that group Medicare Advantage plan that's not in some of these individual ones. So again, I would recommend considering that, and I would recommend calling the administrator of that plan from that employer and understanding what those benefits are, and understanding and by asking them, if you should leave, could you come back? Usually it's no. So that's all I'll say about that. So next, I want to talk about extra help and assistance programs. So I mentioned if you may be on some expensive medications and need a payment plan, there's the Medicare, the M3P plan to help you with installments where you can, if you need help paying for that $2,100 or even less than that, and it's still a lot for you, to divide it up into 12 payment plans, 12 payments for the year, or for however many months are left when it's opted into that Medicare prescription drug payment plan. And then it just may be that you need help paying for prescriptions, whether you're going to meet that $2,100 or not, and lowering the cost of your prescription drug out-of-pocket costs for you. And there are programs, one that's a federal one that's available on a federal level across the states, called LIS, or low income subsidy. So again, it is based on income. There are income requirements. So to find out about that, or if you want to see if you qualify for that and get help, that's something that an agent can help you do. Or you could also reach out to Medicare.gov or wait at 1-800-Medicare. Call that number. Another one is called Medicare Savings Program. Now, this program helps you save on Medicare expenses like co-pays and co-insurances and premiums, deductibles on the provider medical side. However, the Medicare Savings Program is more of a state-based program. So you may either have to apply at your state level in your state welfare office, or when you apply for LIS at a federal level, express interest in being considered for help at a state level with that. And the federal government will pass your information on to the state. And then also some states have what's called state pharmaceutical assistance programs that help people pay for their medication. So you have to check and see if your state offers that and tap into that program. Next, I want to caution you, seniors, people that have elderly parents and loved ones that are on Medicare, beware and be aware and protect yourself and help protect your loved ones against Medicare fraud. Medicare fraud happens in lots of different ways. So I do a whole presentation on different types of Medicare fraud and what are some of the prevalent ones that are out there today. But just at a high level, just want to advise and highly recommend that your Medicare card be guarded. Guard your Medicare card like it's a credit card. It accesses the information on it, helps those that are criminals access so much information about you, and it could lead to fraud, it could lead to identity theft, and it could lead to just loss of property, funds, and that type of thing. Beware of scams. Be aware of unsolicited calls. If you receive calls out of the blue that you didn't give somebody permission to call you, I would just caution you to be aware. Be very careful not to give your Medicare ID number out to someone that you don't know or don't know what they're going to do with that number. So I'm just saying, be aware and be cautious. And do know that Medicare will never call you asking for money or your personal information. So it's highly recommended that you deal with somebody that you know, you trust, or someone referred to you that you trust them in their referral. But be very careful. Another thing is, once you get Medicare, you do want to give that information to your providers if you're going to use just that red, white, and blue card. But once you do that, it's advisable that you store that away at home and not carry it in your wallet or your purse. But if you're going to be on one of those options that was discussed in the webinar, a Medicare Advantage plan or a Medicare supplement, then you'll want to carry that card that you receive from the private insurance company, and you can leave your red, white, and blue card at home and store it away for safekeeping or lock it up or that type of thing. Some key takeaways. So just be reminded that Medicare has 4 main parts. However, Part A and Part B are the only parts that make up original or traditional regular Medicare, just the red, white, and blue card. To get any other benefits, some decisions have to be made in options to either get a Part D plan to cover your prescription drugs to go with that red, white, and blue card, Part A and B, or consider a Medicare Advantage plan that can have Part A, Part B, and Part D included in it, and additional benefits like dental, vision, hearing, gym memberships, virtual visits, those types of things. Or decide if you want to get a Medicare supplement that helps cover that 20%, but does not normally cover prescription drugs, and then get a separate prescription drug plan to go with that and pay the premiums and deductibles for that. Next, it's important to consider the enrollment timeline windows. It's not permissible to enroll in plans for everybody to enroll at any time of the year. It has to be a permissible and valid time for you and your case, your situation. So for instance, there are people turning age 65 throughout the year. They have that 7-window IEP whenever that 65th birthday falls, whether it's close to October or annual enrollment period or not. And then if there are special events that trigger a special enrollment period, that could happen at any time of the year. Other than that, be sure that you have a valid enrollment period to make any changes to your Medicare situation. Other than that, it won't be allowed. CMS will decline the application to kick it out. Options vary by personal needs. So again, plans that you enroll in have to be available in your area, your zip code and county. And a person to get on a Medicare Advantage plan or Medicare supplement has to have both Part A and Part B. And they have to live in the area, at least for Medicare Advantage plans. You have to live in the area where it's available at least 6 months out of the year. And remember that their financial help may be available to pay for both prescription drugs and for medical expenses. There are requirements for everything. There may be limitations, so it's important to ask and seek out what those are and see if you may qualify. And again, you're encouraged to deal with someone that you know, that you trust, and to guard that Medicare card like a credit card to protect yourself against scams and fraud. Now, in closing, again, this presentation was designed to be an educational webinar. So for educational purposes only, and this information is high-level information. It can apply to all Medicare beneficiaries and any company that you may choose where it concerns Medicare Advantage and Medicare supplements. And so again, no specific plan benefits or details were provided. For information, more information, you may visit medicare.gov or call 1-800-Medicare, or you may ask the Medicare Maven, myself. You may call me, you may reach out to me and ask me questions. I do offer a one-time 30-minute free consultation just to hear your status, your situation, to see if it's something I can help you with, or either now or in the future. And if it is, take the next necessary steps to compliantly continue to help you. And if not, I am a part of a team where I may be able to refer you to someone on my team or refer you to someone else that can help you with your situation. By any means, reach out and ask me, the Medicare Maven, and just to share more information. So I've been helping people with Medicare for over 13 years with several different companies, and now with my own company, independent agency, Royal Purpose Shield, protection for your family, finances, and future. Again, if you're new to Medicare, I know you may be getting bombarded with a lot of information, phone calls, mail. I know it can be a lot, but that's why I'm here to help you sort through it, answer questions for you, your Medicare beneficiaries, your loved ones, anyone that's helping you make decisions, or if you just have questions about your Medicare options, or if you need help, extra help paying for prescription drugs, I can assist with that type of information as well. I can help. So again, you may email me, you may call me, you may attend another educational webinar, but reach out and I'll be happy to set something up where I can answer your questions and help direct you on the right road. Again, thank you for attending this Medicare 101. I will put informational links and information how to reach me in the comments below this video. Thank you. And again, I'm Sherry Gordon Harris, the Medicare Maven, broker and agent, licensed in multiple states. Thank you and have a wonderful day.